Good day, everyone. So, my topic would be prostate specific antigen. But before that, let us first define prostate and its important function. So, prostate is a walnut sized gland located between the bladder and the penis. The prostate is in front of the rectum. The urethra runs to the center of the prostate from the bladder to the penis, letting urine flow out of the body. The most important function of the prostate is the production of a fluid that, together with sperm cells from the testicles and fluids from the other glands, makes up semen. So, the muscles of the prostate also ensure that the semen is forcefully pressed into the urethra and then expelled outwards during ejaculation in men. So now, let us define prostate-specific antigen. So, PSA is a 28 kD glycoprotein produced in the epithelial cells of the acini and ducts of the prostatic ducts in the prostate. It is a serine protease of the kallikrein gene family. It functionally regulates seminal fluid viscosity and is instrumental in dissolving the cervical mucus cup, allowing sperm to enter. And the most important role of PSA is in fertility in men. So in healthy men, low circulating levels of PSA can be detected in the serum. So elevated prostate-specific antigen levels can be sign of prostate cancer. It can also indicate non-cancerous problems such as prostate enlargement and inflammation. Then the healthcare provider will work with you to figure out the next steps if ever you have high PSA levels. And then there are two major forms of PSA. First, we have free and complex. So complex PSA, this test directly measures the amount of PSA that is attached to other proteins, while free prostate-specific antigen can help detect this signs of prostate cancer. They measure the level of a biomarker that may indicate the condition. Most of the circulating PSA is complex to anti-chymotrypsin or A2 macroglobulin. The detection of total PSA has been used in screening for and in monitoring of prostate cancer. And so there are other tumor markers. First, we have men with benign prostatic hyperplasia or BPH. So this is a prostate gland enlargement and it is common condition as men get older. And then we have prostatitis. So this is a disorder of the prostate gland usually associated with inflammation. So kanina ko mga na-mention, this has high PSA levels. Most men without prostate cancer have PSA levels under nanogram per millimeter of blood. When prostate cancer develops, the PSA level often goes above 4. Still, a level below 4 is not a guarantee that a man doesn't have a cancer. About 15% of men with PSA below 4 will have prostate cancer if a biopsy is done. So men with a PSA level between 4 and 10, or what they call the borderline range, have about 1 in 4 chance of having prostate cancer. So if the PSA is more than 10, the chance of having prostate cancer is over 50%. So as with other tumor markers, nga katong na-mention ganina, the prostate-specific antigen is not entirely specific. That's why we have the additional tumor markers such as prostate cancer gene 3 or PCA3 starting kaning mga tumor markers are starting to be used to address the lack of the specificity. Then several large clinical trials have shown that although PSA can reduce mortality from prostate cancer, it is only a small reduction in overall risk. Harm from screening in the form of biopsies and treatment may outweigh the benefits. So men at higher risk may consider screening at between 4 to 45 years of age. Okay, para makabalo sila if ilahang PSA level is taas mo or mubo. Especially nga if ang men is mag-range of 40 to 45 years old, kay diha na din mag-start nga inana sa ilahang prostate. Then, screening should always include a digital rectal examination or the DRE. So, DRE is an exam. It is used to see if you might have prostate problem or prostate cancer. So, PSA is measured by immunoassay, which detects both free PSA and PSA complex with alpha-1 anti-chymotrypsin but not A2 macroglobulin. The best clinical use and first clinical application of PSA testing were to monitor for the progression of prostate cancer after the therapy. So this use of PSA to monitor cancer progression has also been found useful after radiation or endocrine therapy. So future directions. So serological tumor markers provide an adjunct to clinical findings and imaging studies for diagnosis, monitoring, and the treatment of cancer. So tumor markers are an area of active research such that laboratorians should remain aware of new guidelines and the development of new tests. So that would be all, and thank you.